Hi, my name is Mapulela Rodi from Tungwazi Production. We are here today talking the impact of COVID-19 on socio-economic well-being. My team and I went out to meet a young lady who's willing to share her story as a survivor, but she decided to remain anonymous because she wants to hide her identity. Anonymous, please do share your story.
It all started the first week of July when I had the flu symptoms. I decided to go to the doctor, but I was not happy because I didn't get tested. The next day I went to the clinic. I got tested and the results were out after 4 days. It was positive. It was unbearable to me when I got the results. Through the help of my sister and my mom, who are working in the health fraternity, they supported me all the time while I was in isolation. My former colleagues and bosses also called to check on me, which was very good because it helped me to get through the situation. Financially, I was not affected because the annual leave, sick leave was used to cover up for the days lost for work. And then when I went back to work, my former colleagues were not treating me the right way. At canteen, I had to sit by myself. During lunchtime, I had to sit on my own. Everything just changed. I decided to relocate and get another job in a town where I am from. So I would like to advise people to take it serious. COVID-19 is there. People are dying of it. Continue with isolation. Continue with sanitizing.
Now we're here at Van Velden Hospital to get a perspective from a health professional. Tell us, how has COVID-19 affected you guys as a hospital, as a profession, and the patients in here?
Thank you for giving me this opportunity. My name is Dr. Peterson. How has COVID-19 affected us as a profession? It has affected us a lot, especially the health professional, because we do see these cases, and it frustrates us when we go to our communities, our patients or our people think it's not there, and we know it that it's there. When patients come in, everyone is screened at the gate. I'm sure you saw it when you guys came in, and when you come in here, we suspect that you've got COVID, as in temperature, coughing, sore throat, anything. You'll be moved into this room. This is an isolation room for COVID. And then there is a ward where we admit patients for COVID. And if there are complications, we send them to the tower. We also send them to Polokwane, depending on how bad the complication is.
Wow, so lastly, what advice can you give to the community?
Phew, the community. I would say to the community to continue social distancing, to continue sanitizing, and to also make sure that they wear their mask all the time, and to remind each other the other person is the one that's going to protect you, and you're going to protect the next person. If somebody's next to you not wearing the mask, you inform them, and make sure that we take care of our elderlies and the ones that we know that have got comorbidities, because they are the ones that complicate more than the rest of the community.
Thank you so much for your time.
Thank you.
Moving to our second victim, who was economically affected by the pandemic.
I had to go for 14 days quarantine, whereby when I came back out of quarantine, I found that my position has been given to someone else. When I asked, I was told that production has to continue. They can't wait for me. This has affected me financially, so because my family also rely on me.
From Tungwazi Production, all we had for you on COVID-19. Continue to sanitize, wear your mask, and distance. Social distancing is important. Goodbye.